Have I had heart images yet?
No, I think when you check out, they'll get them scheduled for you. Don't worry.
Yeah, I finna say I gotta get a brain scan and a CAT scan, but I don't know if I actually had heart images. I had an MRI for my breast.
Yes.
I don't know nothing about a heart yet.
Yeah, so when you check out, we'll go ahead and get that scheduled for you. They just have to get an ultrasound of your heart because one of the medications we're going to give you, doxorubicin, one of your aunts probably got this medication. Probably, I'm almost positive one of them probably got this medication. They maybe told you about it.
Okay.
It's a red medication. Some people call it the red devil. I don't call it that. I call it the red angel. It's a red medication, and basically it can be detrimental to your heart, okay? So we want to make sure that your heart is good.
Okay.
So we don't want to give this to somebody who have heart problems. Okay. So that's what the ultrasound of your heart's going to do. It's going to make sure your heart's A1. We can proceed with the medicine. Okay. It's called doxorubicin. Okay. So you're going to come in every 2 weeks basically. Okay. On the first day, you're going to get all your chemo. The second day is when you're going to get that injection to boost up your white blood cell count, and it's a belly shot. So it's going to happen on the second day. So the first day you'll get this medication. It's called doxorubicin. You'll come in every 14 days to get this medication. You'll get this medication 4 times. So every 2 weeks, 4 times you'll get this medication.
Injected in myself.
It's going to go in your IV. This medication is going to go in your IV. Doxorubicin. It'll go in your port. Sorry. So these pages are broken down into side effects that occur in 30% of people, side effects that occur in less than 30% of people. So the biggest complaints that people have is pain at the actual site the medication is going in. Typically that's with people who have IVs and not ports, so you probably won't have to worry about that. Nausea, vomiting, we already talked about. Low blood cell count, and hair loss. Hair loss is the top 30% of people complain of this, okay? Less than 30% of people just complain of some mouth sores, like I said. Chemotherapy attacks all of your fast-growing cells. Make sure you're drinking plenty of fluids, doing good oral hygiene, prevent those mouth sores. Your urine can turn red because the medication is red, okay? So if you're on day, if you got this medication, like say you got this medication today is Thursday. If by Saturday your urine is still red, you need to give us a call.
Okay.
Because this medication can cause it to be red for a couple of days after.
You said it's Thursday, so if Saturday, that's too long.
Yeah, Saturday would be too long, and I will be wanting you to call me, okay? And it can change the color of your nail beds dark, change your skin color darker. Once you're done with the medication, it'll grow out, go back to its normal color. And then it talks about, of course, problems with fertility and childbearing. So that's why we want to make sure you talk to a fertility doctor too before you start this medication. Talks about when to call a doctor. We already talked about fevers. Fevers, the biggest thing with fevers is greater than 100.4. Chills, shortness of breath, difficulty breathing. If you're having mouth sores, if you go home and you have nausea, you take your Compazine, it's not helping, give us a call. If you're having pain, anything like that, you need to give us a call about. Precautions and self-care tips: drink plenty of fluids. Don't get pregnant while you're on this medication. Make sure you're using any kind of contraceptive.
What if I did get pregnant?
It could be detrimental to your baby. It's a tetragenic medication, so that means when your fetus is at its growing stages, it could be detrimental to the baby. So that's why they talk to people about it, because it can be harmful to them. Not that we just don't want you to get pregnant, but it could be harmful to the baby. Because the same thing it's going to do to your body is the same thing it would do to a tiny baby. So we don't want that. But if you did, I've had people get pregnant on it. I have had people get pregnant, and we just kind of have to stop their therapy because you can't. You have to wait until they have the baby or do find it fertility.
So y'all stop chemo if you get pregnant?
Yeah, because we can't unless they were. It would depends. Like if somebody was in their 3rd trimester, it might be okay, or the 2nd trimester, it might be okay. There's some safe windows.
But the first trimester.
But the first trimester is pretty detrimental. Exactly. The next one, so you're going to get these 2 drugs together. The doxorubicin, which is the red medication I was just talking about, and you're going to get this medication as well, okay, cyclophosphamide. You're going to get it on the first day as well, and it pretty much has some of the same side effects, okay? Low blood cell count, so that's your white blood cells as well as your red blood cells. So people can be anemic on this medication, and that's why they feel a little bit fatigued when they're taking it. Hair loss, nausea, vomiting, poor appetite, discoloration of your skin again. Loss of fertility, diarrhea, mouth sores. This medication can cause bleeding in the bladder. That's why after that 2nd day, if you still have red urine, you need to call us. Okay? Same kind of precautions and self-care tips. Drink plenty of fluids. Don't get pregnant. Call if you have fevers greater than 100.4, nausea, vomiting that's not controlled, any side effects, anything you would normally call your family doctor for, call us.
So is these the medications that he was saying that is taking my estrogen down?
Yes. Yes.
And basically, these are the ones that's stopping me from being able to have a baby
Right.
too.
So once you get done with these medications, okay, then you're gonna go to your surgeon. Surgeon's gonna take your boobs out, whatever you want to do, lumpectomy, mastectomy, whatever. Then from there, you come back to us and we start you on hormone therapy. If your tumors are hormone secreting, I believe they are. When that happens, then we'll be giving you a medication to suppress your ovaries because you can't take these hormone medications and your ovaries are still active. So we'll give you a medication to suppress your ovaries. That's probably the one he was talking about.
Have you ever seen somebody come back and their period come back from this?
Yeah, I mean, you can have a period. Some people can have a period. That's why we suppress it, because we don't want you.
You know, but it seems as if once the menopause kick in.
So some of these medications, so what will happen is while you're taking these medications, your periods may be off because it's killing your cells, it's doing different things to your body. Once you're done taking these medications and you go to just the hormone therapy, you can have regular periods.
And so I can still have a baby.
You can still have a baby, you can still get pregnant.
Okay.
But the problem is we have to give you something to suppress your ovaries, to suppress those hormones that your your cancer would feed on. So then that's when people aren't able to have babies with that fertility. Okay. So yeah, your tumor was estrogen and progesterone positive. So he will probably put you on something like a Nastrozole after you get all of your after you see your surgeon, which is a pill that you would take for 5 to 10 years. I'm sure that he already talked to you about
that. Right there was me stopping my estrogen for those.
And then there's an injection that goes along with it that will stop your estrogen, yes.
So for 5 to 10 years, that will keep on going.
Yeah.
Yeah, and that can stop me from having a baby.
Yeah.
But if I stop taking that pill, what would that do to me?
If you was to stop taking it, it would depend on. It would put you more at risk for your cancer coming back, basically.
Another question, is it like a guarantee that I'll lose my nipples?
Oh, that part I'm not sure. Are you having a mastectomy or what are you doing? You don't know yet?
I have no idea.
So you'll have to wait until you see your surgeon. But usually they can do nipple sparing, depending on where your tumor is. Do you know where it is?
Over here.
Right, they can do nipple. You still can feel it?
Yeah, it's big. It's a walnut size. I mean, they say it's like a peanut, but to me, it feels like this big.
So as you start getting chemos, keep feeling it. It'll start going down, and it's gonna be like amazing. Okay, you're gonna be like, what the heck?
Right.
So it's gonna start going down. But since it's here, they should be able to do nipple sparing.
That's what I'm thinking.
But I would ask the surgeon.
But another one over here, which is 2, is kind of in there a little bit.
So just talk to your surgeon.
It's Jesus that is doing a lot to me at 32.
Yeah.
And I understand there's nothing that can be done, but I'm just trying to say whatever I can.
Yeah, just talk to your surgeon about it for sure. Okay, so you're gonna get 8 rounds of chemo basically. Okay, It's gonna be 4 rounds of these 2, and then the last 4 rounds is gonna be a different medication. Okay. That's why I made a calendar. Okay, because there's a medication that you're supposed to take before you start this medication. Okay. You know what dexamethasone is? It's a steroid. Okay. And you have to take it so that you don't have side effects from this Taxotere. Okay. It's just a small dose of steroid, not a lot, I promise.